So basically, the field is a relatively young field in medicine compared to others. It really started in the 1960s here in the Pacific Northwest. Most of it started in Oregon at OHSU, which is located in Portland. And a radiologist by the name of Charles Daughter there is really the founder of interventional radiology as we know it. He was a radiologist by training, as we all are, and he basically said, well, if I can inject dye into these parts of the body, why can't we try to do procedures in them? So one of his first patients was a patient with vascular disease, so narrowing of the blood vessels, so plaque building up on the walls of arteries. And it's really like plumbing. If the pipe is blocked in somebody's leg, then they may not be able to walk very easily, or they may not be able to feel their foot. So the way to treat that is typically a surgeon will do a bypass. They put in a new pipe that goes around the old pipe. But this patient that he was thinking of treating really wasn't a good surgical candidate and didn't want a surgery. So he said, well, can I go inside that vessel and put something inside the vessel to open up that blocked passageway or blocked pipe? So he basically developed techniques of IR as we know it today. We've developed a lot more sophisticated material and techniques and supplies that we use now, but he really was the first person to have the idea that to stick something in there to open up narrow blood vessel. And in the 1970s, our techniques really took off in terms of treating things like I mentioned, trauma, bleeding in the liver, or the kidney, or the pelvis. So stopping bleeding from happening with inside the body instead of taking somebody to the operating room. The future of IR rests in getting to parts of the body we've never been to before, and also really developing techniques that are specific to the patient. So particularly in the fields of cancer or chronic diseases where we can deliver drug therapy specifically to the body part that's involved.